I'm Dr. Sri. I'm a board certified family medicine and sports medicine doctor with a background in exercise physiology and integrative medicine. In this video, we're going to discuss how I help my patients who suffer from obesity. So this will be an extensive video. We'll first cover the cause of obesity, examining whether it stems from environmental and lifestyle factors or if it is genetic. Then we will delve into the best nutritional strategies for weight loss, the importance of exercise, how implementing certain behaviors can aid in weight loss, the circumstances under which I consider pharmaceuticals for obesity, and when I refer patients for surgery. Hopefully, you're going to find all the answers in this video to combat obesity. So without further ado, let's get started. So before we delve into the question of whether obesity is purely due to environmental factors or not, let's consider some facts right now. In recent years, the average individual's physical activity at work has reduced by at least 100 kilocalories per day. So utilizing this specific calculation to predict weight gain, one could potentially gain around 1 pound per month. This equates to an increase of approximately 12 pounds in a single year. So statistics highlight that the daily calorie intake for the average person has increased by at least 200 kilocalories and sometimes even more. So such a surplus in caloric intake theoretically could lead to a weight gain of roughly 24 pounds over the course of a year. So in my clinical experience, I frequently observe this pattern among my patients, which is why we address weight during each visit. So sometimes a 12-pound weight gain after 1 year may not seem even noticeable for some of my patients, but the cumulative effect of the weight gain after 5 years is going to start causing a lot of health problems. Are we then to conclude that individuals who gain weight are simply those who do not engage in physical activity and it's entirely due to environmental factors? Unfortunately, the answer is not so straightforward. So studies have shown that there is a genetic predisposition that is linked to obesity as well. For instance, a person without a genetic predisposition to obesity might have better regulated hunger hormones and appetite control, and they might expend more energy while at rest compared to someone with obesity who may not burn as many calories at rest. Even if they exercise and burn calories during physical activities, their body could have a set point that prevents them from burning more energy throughout the rest of the day. However, the biggest challenge is to find the exact contribution of the environmental factors as well as the genetic factors when it comes to obesity. Many patients come and tell me that despite being very careful with their diet and physical activity, they still continue to gain weight. And indeed, this can entirely be true. They might be comparing themselves to someone else who might be eating whatever they want, they might not be exercising regularly, and they still may not gain weight, whereas individuals with obesity might be paying attention to their dietary habits and still continue to gain weight. This is what I tell people, that there is a lower threshold for some people to develop obesity or to develop weight gain, and we still don't have a definitive answer to this issue. The prospects of genetics and epigenetics in addressing obesity and metabolic disorders appear bright, laying the groundwork for precision medicine. But still, it's important to recognize that a genetic predisposition does not negate the substantial impact of environmental factors. So it's important to understand that even though there might be some genetic predisposition to obesity, the environmental factors actually could be causing those genetic mutations or epigenetic modifications that might be increasing the risk for obesity. Which is why the genetic testing is not a standard part of clinical practice, and it will always be harder to know how much we should focus on the genetic modification or how much we should focus on the environmental factors. For example, the pharmaceuticals might come up with a drug to help with a particular genetic mutation. So let us say, for example, a particular subset of people might have some leptin resistance, which causes problems with appetite control, and the pharmaceutical might come with a medication for that. But still, it's very hard to know how much the environmental factors is actually playing a role, which is why even in future as well, in the future of precision medicine and things like that, the genetic testing might come as a part of a clinical practice, but still the environmental factors, we cannot just downplay the environmental factors that is causing the obesity as well. So let's see how we define obesity. So in the clinical world, we use body mass index. So BMI of more than 30 is considered obese. The problem with the BMI is that it's not a very accurate measure and can overdiagnose or sometimes can underdiagnose as well. I'm not worried about overdiagnosis. For example, let's say I see a BMI of 35, but then when I go into the room and this person is highly muscular with a slim waist, then I know that this BMI overdiagnosed on this individual, and I'm not worried about it. But I'm more worried about underdiagnosis. For example, a person can have a BMI of 28, but still based on other measurements like waist circumference or waist hip ratio, this person can be obese. But because you look at a BMI of 28 and think it's normal, then you're just missing an opportunity to change someone's long-term health. For this reason, I incorporate both waist circumference and the waist to hip ratio, and I combine these with BMI for a more comprehensive assessment. A waist circumference greater than 40 inches for males and greater than 35 inches for females is considered to indicate central obesity, basically, which means that there is excess fat that is located around the abdomen, which is associated with an increased risk for obesity-related health conditions. It is worth noting for Asian populations, the thresholds are set lower at greater than 90 cm or 35 inches for males and greater than 80 cm or 31.5 inches for females. The World Health Organization defines obesity based on waist-hip ratio, setting the threshold at 0.90 or higher for men and 0.85 or higher for women. A waist-hip ratio greater than 1.0 for either sex indicates a significantly higher risk of health problems related to obesity. To calculate the waist-hip ratio, follow these steps. Measure the narrowest part of your waist, usually just above your belly button. Ensure the tape measure is snug but not compressing your skin. This will give you a waist circumference. Now, measure the widest part of your hips where the hip bone protrudes the most on both sides. This is usually at the level of your buttocks. This will give you hip circumference. Now, divide your waist measurement by hip measurement. This will give you a waist-hip ratio. The waist circumference and the waist-hip ratio is very important when it comes to determining obesity in Asian individuals and Hispanic individuals. I've seen a lot of patients with a normal BMI, but they classify under obesity based on the waist-hip ratio and the waist circumference. Some people would ask about DEXA scan to determine the lean body mass and fat mass. In my opinion, it's too expensive and the measurements that we talked about is more than enough to determine whether one is suffering from obesity or not, or one is going to have obesity-related health problems or not. So let us first understand why I want to treat obesity. Obviously, when most patients come to me, there might be some psychological motivation where they want to lose weight for aesthetic purposes. But there are some people who may not even consider that as a problem. But I still have a conversation about losing weight because obesity can cause a lot of metabolic health problems. It can also cause a lot of problems that just comes from the body mass itself. For example, some people might have a poor metabolic health due to obesity and thereby increased risk for heart disease and type 2 diabetes. However, there are some people who can have completely normal lab results, they have good metabolic health, but still suffer from conditions such as knee osteoarthritis or hip osteoarthritis or obstructive sleep apnea or tendinopathies, and all these is going to cause increase the risk for physical inactivity and thereby increased risk for heart disease and type 2 diabetes in the future. They may also develop skin disorders due to obesity as well. The implications of obesity on health are multidimensional, affecting individuals in complex and varied ways. Now let us discuss the treatment of obesity. The solution is pretty straightforward. So one has to create a calorie deficit to lose weight. But here is the catch. So one could create a calorie deficit by two ways. So one subset of people can lead a healthy lifestyle, they exercise regularly, and then they create a little bit of a calorie deficit through portion control and lose weight. Whereas another subset of people, they can go into a starvation mode and on top of that, they can eat unhealthy foods and still lose weight based on the calorie deficit model. But the problem is that even when you take these two subset of people, what is the impact of their long-term health in the future? So what about let's be the person, the subset of people who are actually in a starvation mode and who's still eating unhealthy foods? What could be the long-term metabolic health? What about the nutrition deficiencies that they might encounter because of this type of lifestyle and thereby leading to change in their health in the future? So that's why it's not just important to lose weight, but we also want to make sure that we promote overall health in the future as well. So nutrition is a key component in the treatment of weight loss and it costs nothing. Physical activity is equally important, yet the two must be combined for optimal results. Neither can effectively replace the other. Now let's delve into the topic of nutrition with an evidence-based perspective. So is one particular nutritional approach superior to others? For instance, is time-restricted feeding more effective than continuous feeding? Or is the keto diet better than the Atkins diet or the low-carb diet or the Mediterranean diets? So studies have shown that when it comes to macronutrient composition, no nutritional approach significantly outshines the others. It is important to note that diets high in ultra-processed foods are going to be detrimental to health. Most dietary approaches emphasize the importance of adopting healthy lifestyle changes. For example, the Atkins diet encourages increased fiber intake and reduced consumption of processed foods, a principle that is similarly evident in the keto diet and the Mediterranean diet as well. Let's consider low-fat diet. So when we think about low-fat diet, the fat composition is going to be less than 15%. The problem with this diet for most people is that So this will lead to more consumption of ultra-processed carbohydrates and thereby lead to weight gain. However, if one follows the low-fat diet in a proper way, where they increase the consumption of dietary carbohydrates that are rich in fiber, then in that scenario, the low-fat diet will also work really well when it comes to treating obesity. So when you think about keto diet, it restricts carbohydrates and increases fat consumption, leading to weight loss by altering the macronutrient distribution in one's diet. But think about it. When you restrict carbohydrate, you have fewer options, and thereby it's easier to facilitate a calorie deficit. The Atkins diet also emphasizes macronutrient restriction and thereby helping to lose weight. I'm particularly supportive of the Mediterranean diet, which focuses on healthy fats such as those from olive oil, nuts, and omega-3s found in fatty fish, along with a high intake of fiber-rich foods. It represents more of an eating lifestyle than a strict diet, promoting weight loss and overall health. So time-restricted feeding, where one might fast for 16 hours and then they would have an eating window for 8 hours, that also shows promise in weight loss. But there are no studies to prove that time-restricted feeding is superior to other nutritional approaches when it comes to weight loss. Ultimately, the key takeaway is that various diets and eating habits can be effective as long as they involve healthy food choices and create a calorie deficit, aiming for a reduction of at least 500 kilocalories a day to facilitate weight loss. So many people ask me, why one should diet, or basically why we should lead a lifestyle with a strict discipline. But the problem is that we are surrounded by environmental temptations at this time, which was not present many years ago. For example, many years ago, when we didn't have the option of vending machine, or we didn't have the option of Ziploc bags to carry snacks and things like that, we had a pretty standard, like a breakfast, lunch, dinner with minimal snacking. There was a lot of physical labor involved, and there was no concerns about weight gain. But now think about my life. I'm sitting in front of the computer, I can get bored, and there's a vending machine right here that I can go get a snack. And if I don't pay attention, then I can start to gain weight. So which is why I have to implement some sort of discipline in my life to make sure that I'm very careful about gaining weight. So for example, I adopt a time-restricted feeding where I don't eat until noon. So for example, right now the time is going to be almost 1 o'clock. I'm not eating any food at all. And this is helpful because I'm kind of focusing on my work and have a strict rule that I would not eat at this time. So this way I'm not thinking about my breakfast or things like that. And then in the afternoon, I would probably eat some sort of a salad while I'm actually working, so I don't take a lunch break. And then when I go home, I'll have a good dinner. And again, I want to pay attention to my dinner as well because it's easy to overconsume during dinner as well. The best nutritional approach that I would want to follow is to skip the dinner. But the problem is that my work never ends before 7 p.m. sometimes, and thereby, right now, this is kind of the perfect lifestyle that fits well for me, and it works. But again, this is what we talk about when it comes to a nutritional approach in treating obesity. You want to pick a lifestyle that works for you. You don't have to pick a lifestyle that worked for somebody else. If it worked for somebody else, maybe that was the perfect lifestyle, which is why that particular person was successful. But if that particular lifestyle doesn't work for you, then you're not going to be successful. I see many patients who have found success with restrictive diets like keto diet or Atkins diet or paleo diet, but they struggle to maintain the weight loss once the diet ends. This highlights the importance of sustainable practices over temporary diets. If adherence becomes an issue, it's crucial to explore other options, possibly in consultation with a doctor or nutritionist, to devise a plan that is both effective and manageable. This personalized approach ensures a balanced relationship with food and health, tailored to individual needs and lifestyles. Now let's delve into eating habits basics. So the first thing that you want to avoid or completely eliminate is the ultra-processed foods. And that's your biscuits, cookies, donuts, pizzas, and sweetened beverages and so forth. These are loaded with empty calories, they don't have much of a nutritional value, and they increase the risk for weight gain. The next recommendation is to increase your fiber and protein intake. Both nutrients are satiating, helping to curb appetite effectively. By focusing on incorporating more protein and fiber-rich foods into your diet, along with carbohydrates that are high in fiber, you can make healthier dietary choices. So if you want to know how to make sure that you choose the right dietary carbohydrates that are high in fiber to help you lose weight, then make sure that you check out the video that is linked in the description box below. Another concept that I stress is the importance of mindful eating. So rather than viewing food choices as a punishment or obsessively counting calories, try to enjoy your meals mindfully. Mindful eating involves paying close attention to your food and listening to your body's cues to recognize when you're full. It also includes being aware of external factors like stress that might influence your eating habits. I've created a detailed video on how to get started with mindful eating, and I'm going to link that video in the description box below. So after focusing on the protein and the dietary fiber intake, the next one is to make sure that you consume healthy fats. Completely eliminate processed trans fats and fried foods and increase the consumption of healthier fat options like nuts and seeds. Although nuts are healthy, it's important to consume them in moderation because nuts are high in calories. I suggest opting for raw or soaked nuts over roasted or salted varieties, as the processing might alter their nutritional profile, potentially turning them into less healthy options. When it comes to fasting, I usually tell my patients to fast at least 12 hours a day. For some patients, a longer fasting option might still be very helpful. Now let us talk about exercise. When it comes to exercise, I typically advise my patients not to focus solely on exercising more to lose weight. It's crucial for them to meet minimum exercise recommendations, which generally consist of 150 to 300 minutes of combined moderate to vigorous intensity exercise per week, as well as aiming for 10,000 steps daily. The issue arises when individuals attempt to exceed these goals, such as aiming for 450 minutes per week or more. I discourage this, particularly for those struggling with obesity, as it can lead to overuse injuries. The key objective is to begin at a comfortable pace and progressively build up to avoid injury and establish sustainable exercise habits. So building lean muscle mass or preserving lean muscle mass while dieting is very crucial. So sometimes even when you think about it, like let's say if you have an increase in lean muscle mass, or if you preserve a lean muscle mass that can even burn like 100 calories per day, that still is going to be significantly impactful in the long term. Aim for a minimum of 2 days of strength training per week, but striving for 3 days per week is an excellent goal. I recommend checking out the video linked in the description box for guidance on planning your strength training workouts. Studies unfortunately show that even with intensive lifestyle interventions, one can lose only up to 3 to 5% of the body weight. Some studies show maybe up to 9%. But then obviously there are a lot of case reports where people have done strict lifestyle modification for years together and have lost a significant amount of weight. But I'm just talking about the studies that show average. So when you pool a lot of studies and then you to see how much weight loss intervention is possible in an average, then you're looking at almost like 3 to 5% or maybe up to 8% or so. So this is where pharmaceuticals and surgical approaches might come, especially for people who are suffering from obesity with a body mass index of more than 40 or so. When patients struggle to curb their appetite despite various strategies, we often discuss medication options. Most of these medications aim to suppress the appetite. For example, phentermine is a commonly prescribed appetite suppressant that can kickstart a patient's weight loss journey, typically resulting in a 5 to 10% reduction in weight. Another medication, commonly known as Contrave, which is basically a combination of naltrexone and bupropion, it helps to reduce cravings and diminish the rewarding sensations associated with eating certain foods. This can be particularly helpful for individuals who experience a strong positive reinforcement from eating sweets, leading them to desire more. However, the weight loss associated with these medications is not very substantial. We're looking at somewhere between 8 to 10% of body weight loss by using these medications. In the last few years, we have had the introduction of the GLP-1 analog injections. So basically, the GLP-1 hormone, you're basically kind of administering from outside, and these medications can suppress the appetite so effectively that can create a substantial weight loss. So the brand name are basically Ozempic, Wegovy. There's also a combination medication called as the Mounjaro, which is basically a combination of GLP-1 and GIP-1. So basically GIP is basically a glucose-dependent insulinotropic polypeptide, another hormone that can help with weight loss. So these combination medications and as well as the GLP-1 analog injections, we are looking at somewhere between 15 to 20% weight loss with these injections. However, these injections are not devoid of side effects, and there is also an increased chance of weight regain by using these medications. I would highly recommend to watch the video that I'm going to link in the description box below on how to use these medications effectively so that you get the maximum benefit from using these injections. For patients with a significantly higher BMI, so I'm talking about more than 50 or 60 or so, in those patients I discuss about surgery. Again, there are a lot of cases where people have lost weight even without any help from like a pharmaceutical component like medications or surgeries. But it is hard. Not everybody will be able to do that. So for some people, there might be an urgency to lose weight faster. For example, they might be having complications that is associated with diabetes. They could be having severe knee arthritis that is causing pain, or they might be having uncontrolled diabetes or so. In those cases, weight loss surgery can be a faster way to achieve weight loss. Again, it also requires intensive dietary lifestyle interventions to make sure that one can make sure that they can lose weight long term. But still, the surgery can help people lose weight faster, so that thereby they get the benefits of weight loss right away. Currently, the general guidelines for weight loss surgery indicate that it might be an option for adults with a BMI of 40 or higher. Furthermore, weight loss surgery may also be considered for adults with a BMI between 35 and 39.9 who suffer from obesity-related health issues such as type 2 diabetes, high blood pressure, or severe sleep apnea. Even though the guidelines talk about considering weight loss surgery for BMI of 40 or more, these guidelines were done before the introduction of the weight loss injections. Since the weight loss injections can provide almost 15 to 20% weight loss, we don't usually be aggressive about considering surgery in patients with a slightly higher BMI. I still would consider weight loss injections. But again, with a higher BMI of BMI of 40 or BMI of 50 or 60 or higher, in those cases, I think surgery has far more benefits when it compared to weight loss injections. Although most patients with BMI more than 50 or 60 can still attain the weight loss goal by just using the injections alone. When it comes to surgery, there are two primary surgical options: gastric bypass and sleeve gastrectomy. These procedures come with their risks and benefits, and I strongly advise discussing them with a surgeon or consulting with your primary care physician about the possibility of surgery. I hope this video was helpful. If you have any questions or comments, please post in the comment box below. If you want to know more about weight loss injections, then I highly recommend to check out this video here. If you want to know more about mindful eating, then I highly recommend to check out this video here. The other videos that we talked about, all the links are in the description box below, and I'll see you in the next video. Until then, goodbye.